Welcome to our exploration into the world of personality disorders. These mental health conditions are characterized by rigid and unhealthy patterns of thinking, functioning, and behaving. Unlike the everyday personality traits that define how we view ourselves and relate to others, personality disorders can lead to significant impairments and distress in a person's life. It's crucial to understand that these disorders are complex, often misunderstood, and differ significantly from the normal spectrum of human emotions and behaviors. Before we dive deeper, it's important to note that the script, voiceover, and images for this video are entirely generated by AI, ensuring a comprehensive and insightful look into the subject. Personality disorders are a group of mental health conditions marked by enduring patterns of inner experience and behavior that deviate markedly from the expectations of the individual's culture. These are not occasional deviations, but are pervasive and inflexible, leading to significant distress or impairment in social, occupational, or other important areas of functioning. The patterns of thought, feeling, and behavior are deeply ingrained and typically manifest by adolescence or early adulthood, continuing over many years. It's essential to recognize the impact of these disorders on an individual's life, affecting their ability to relate to others and handle everyday stresses and problems. Moving on to the types of personality disorders, let's start with cluster A, also known as the odd or eccentric disorders. This cluster includes paranoid, schizoid, and schizotypal personality disorders, each with unique symptoms that affect a person's interactions and relationships in distinct ways. Paranoid personality disorder is characterized by a pervasive distrust and suspicion of others, causing individuals to believe that others are out to harm or deceive them, even without evidence. This can lead to significant issues in relationships, as the person may constantly doubt the loyalty or trustworthiness of those around them. Next, individuals with schizoid personality disorder exhibit a profound detachment from social relationships and a restricted range of emotional expression in interpersonal settings. They often prefer solitary activities and may seem emotionally cold or indifferent to others, making it challenging to form personal connections or share their thoughts and feelings. Lastly, schizotypal personality disorder involves acute discomfort in close relationships, cognitive or perceptual distortions, and eccentric behaviors. Individuals may have odd beliefs or magical thinking, such as believing they can influence events with their thoughts. This disorder makes it difficult for them to form relationships, as their unusual behaviors and thoughts might be off-putting to others. We now move to cluster B personality disorders, known for their dramatic, emotional, or erratic behaviors. This cluster includes antisocial, borderline, histrionic, and narcissistic personality disorders. Individuals with these disorders often experience intense emotional reactions and have significant challenges in their relationships. Let's delve into each disorder to understand their characteristics and the impact they have on a person's life. Antisocial personality disorder is marked by a disregard for and violation of the rights of others. Individuals with this disorder may engage in deceitful, manipulative, or even criminal behavior without remorse. They often struggle with societal rules and norms, leading to conflicts with law enforcement and difficulties in maintaining stable relationships. Borderline personality disorder is characterized by instability in moods, self-image, and relationships. Individuals may experience intense episodes of anger, depression, and anxiety that last from a few hours to days. They can have difficulty maintaining relationships due to their emotional swings and fear of abandonment, often resulting in a pattern of intense, unstable relationships. Histrionic personality disorder involves excessive emotionality and attention-seeking behavior. Individuals with this disorder often feel uncomfortable when they are not the center of attention and may use their physical appearance to draw attention to themselves. Their emotional expressions can be rapidly shifting and exaggerated, making it challenging for them to form authentic, deep relationships. Lastly, narcissistic personality disorder is characterized by a pattern of grandiosity, a need for admiration, and a lack of empathy for others. Individuals may have an inflated sense of self-importance and entitlement, expecting special treatment and admiration from others. Their relationships are often superficial and exploitative, as they struggle to recognize or meet the needs of others. Transitioning to Cluster C personality disorders, we explore a category defined by anxious and fearful thought patterns and behaviors. These conditions exemplify how anxiety can permeate an individual's personality, influencing their interactions and shaping their lives in profound ways. Let's delve into the specifics of avoidant, dependent, and obsessive compulsive personality disorders to better understand the challenges faced by those dealing with these conditions. Avoidant personality disorder is characterized by a pervasive pattern of social inhibition, feelings of inadequacy, and hypersensitivity to negative evaluation. Individuals with this disorder often view themselves as socially inept, personally unappealing, or inferior to others. This can lead to a significant withdrawal from social interactions, despite a strong desire for intimacy, because the fear of criticism, disapproval, or rejection is too overwhelming. Dependent personality disorder manifests as a need to be taken care of, leading to submissive and clinging behavior and fears of separation. This dependency results in difficulties making everyday decisions without an excessive amount of advice and reassurance from others. People with dependent personality disorder often struggle with self-confidence and autonomy, relying heavily on others to meet their emotional and physical needs. Lastly, obsessive-compulsive personality disorder, OCPD, is marked by a preoccupation with orderliness, perfectionism, and control at the expense of flexibility, openness, and efficiency. This disorder is more than just being detail-oriented. It's a deep-seated need for control that can hinder productivity and strain relationships. Individuals with OCPD often struggle to delegate tasks, may be rigidly devoted to rules and schedules, and can become excessively fixated on lists and details. Understanding the causes of personality disorders is crucial for both diagnosis and treatment. These conditions are believed to result from a complex interplay of genetic, environmental, and psychological factors, making them challenging to pinpoint and address. First, let's explore the genetic component. Research indicates that personality disorders, much like other mental health conditions, can have a hereditary aspect. This means that individuals with a family history of personality disorders may be at a higher risk of developing these conditions themselves, suggesting that genetics play a significant role in their manifestation. Moving on to environmental factors, it's clear that a person's upbringing and life experiences have a profound impact on their mental health. Traumatic events, such as abuse, neglect, or loss, especially during critical developmental periods in childhood, can significantly increase the likelihood of developing a personality disorder. These experiences can shape an individual's worldview, affecting how they perceive themselves and others, which can lead to unhealthy patterns of thinking and behaving. Lastly, psychological factors also play a pivotal role in the development of personality disorders. This includes an individual's temperament, coping mechanisms, and the ability to manage stress. Personality development can be adversely affected by maladaptive coping strategies, leading to the entrenched patterns of behavior that characterize these disorders. Cognitive distortions, such as black and white thinking, overgeneralization, and jumping to conclusions, can exacerbate the condition, making it difficult for individuals to maintain healthy relationships and cope with life's challenges. Diagnosing personality disorders is a meticulous process that healthcare professionals undertake with great care. The cornerstone of diagnosing these complex conditions is the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, commonly known as the DSM-5. This manual provides a standardized classification and criteria for mental disorders, including personality disorders. To make a diagnosis, clinicians assess whether a patient's symptoms align with the specific criteria outlined for each personality disorder in the DSM-5. This involves a thorough evaluation of the individual's long-term patterns of thinking, feeling, and behavior. However, diagnosing personality disorders goes beyond simply matching symptoms to criteria. A comprehensive psychological evaluation is essential. This involves detailed interviews with the patient, and sometimes with their close contacts, to gain a deep understanding of their personal history, relationship patterns, emotional functioning, and coping mechanisms. Health professionals may also employ various psychological tests to measure personality traits, assess cognitive functions, and identify maladaptive patterns. This holistic approach ensures an accurate diagnosis, taking into account the complexity of an individual's psychological makeup and the impact of their environment. The importance of a comprehensive evaluation cannot be overstated. Personality disorders are often characterized by symptoms that can overlap with other mental health conditions, such as anxiety disorders, depression, or other personality disorders. Therefore, a detailed and careful assessment ensures that the diagnosis is precise, which is crucial for developing an effective treatment plan. Furthermore, understanding the unique challenges and strengths of each individual allows healthcare providers to offer the most supportive and beneficial therapeutic interventions. Now that we've explored the types, symptoms, and diagnostic process of personality disorders, let's delve into the most critical aspect: treatment and management. Managing a personality disorder can be a long-term process, but with the right strategies, individuals can lead fulfilling lives. The primary treatment approaches include psychotherapy, medication, and lifestyle modifications, each playing a unique role in the comprehensive care plan. Psychotherapy, also known as talk therapy, is often the cornerstone of treatment for personality disorders. It involves regular sessions with a therapist, focusing on understanding the disorder, learning coping strategies, and improving social skills and relationships. Different types of psychotherapy can be effective, including cognitive behavioral therapy, CBT, dialectical behavior therapy, DBT, and schema therapy, each tailored to address specific aspects of personality disorders. While psychotherapy aims to address the root causes and behavioral aspects of personality disorders, medication can be helpful in managing specific symptoms. For instance, antidepressants, mood stabilizers, or antipsychotic medications might be prescribed to help control mood swings, depression, or other co-occurring conditions. It's important to note that medication treatment is usually most effective when combined with psychotherapy. Lifestyle modifications also play a crucial role in managing personality disorders. Regular physical activity, a balanced diet, adequate sleep, and stress reduction techniques can significantly impact one's mental health. Additionally, building a strong support network, whether through family, friends, or support groups, provides the emotional backing necessary for recovery and long-term management. In conclusion, while personality disorders can be challenging, a multidimensional treatment approach incorporating psychotherapy, medication, and lifestyle changes offers the best chance for improvement and stability. It's essential for individuals to work closely with their healthcare providers to develop a personalized treatment plan that addresses their specific needs and goals. In wrapping up our journey through the intricate landscape of personality disorders, it's paramount to underscore the importance of understanding, compassion, and empathy towards those affected. Each day, countless individuals navigate the challenges posed by these disorders, often facing misunderstanding and stigma from society. By fostering an environment of acceptance and support, we can break down the barriers that prevent people from seeking the help they need. If you or someone you know might be experiencing symptoms of a personality disorder, it's crucial to reach out to a healthcare professional. Early intervention can make a significant difference in managing these conditions, leading to a healthier and more fulfilling life. Remember, seeking help is a sign of strength, not weakness, and everyone deserves the opportunity to thrive. Thank you for joining us on this insightful journey into the world of personality disorders. If you found this video informative and helpful, please give it a thumbs up and share your thoughts or personal experiences in the comments below. Your engagement not only supports our channel, but also helps in spreading awareness and understanding about personality disorders. Don't forget to subscribe for more content on mental health and to join a community dedicated to fostering support and education on these important topics. Remember, every like, comment, and share contributes to building a more informed and empathetic world for individuals navigating the challenges of personality disorders. Together, we can make a difference.